And hello there. I'm a minute early today. It is Friday. It is our Lunch and Learn with me, Dr. Polly Heil-Mealey at Abundant Health and Wellness. Now, we are located downtown Humble at Main Street and Avenue C. So I'm going to give you just a few minutes to check in. I know last week we were doing just fine and Facebook just kicked me out. So if that happens again, we definitely will come back and see you. So try and make sure that you try and join me again. Today we're going to talk about micronutrients, okay? So a micronutrient is a nutrient that is found in food. It's a very small amount that you need, but boy, can it make a big, big difference in your body. So we're going to be talking about a few different things. And so a couple of weeks ago, we were talking about something, and I think it was on the immune system. It may have been on parasites, and somebody said that they had done some kind of treatment, and I said, well, it wasn't really an ethical treatment or something to that effect. And the comeback was, oh, I'm sorry, I got onto your sales pitch. Well, this is not a sales pitch. I show you products because I want you to know that we do have what I'm talking about, and our products are not from Amazon. They're not counterfeit. They're not dirt. They actually have what they say they have in them. They have been independent third-party certified, so we know that what you're getting is what actually we tell you that's in there. And so this is a reason why we show products. I don't want anybody to think that I am here to push products or to sell you something. However, if the education that you find is beneficial for you and you want to have good, reputable products, this is why I show you what we have. So hope that clears up any misunderstanding. Those of you who know me know that selling products is very much secondary to helping you regain your health. So with that being said, I want to just go on to some of our macronutrients, and so we can see where we are. So one of the things that I want to talk to you about today is something called CoQ10, coenzyme Q10. Okay, so this is a enzyme. Your body does produce it, but as you age, your body produces less and less of it. If you take a statin drug, now hopefully we're all much smarter than that now, but if you take a statin drug, your statin drug is going to deplete your CoQ10. So many metabolic diseases can be attributed to a deficiency in CoQ10. Okay, CoQ10 helps with inflammation, and we know that unchecked inflammation is the bedrock of any disease. And so we want to look at CoQ10. There were 9 clinical trials involving 428 subjects, and the meta-analysis, right, said that a daily dose of CoQ10 varied from 100 to 500 milligrams a day. All of the control groups received this, and then the other groups received a placebo as well. So CoQ10 supplementation was demonstrated to significantly improve the serum level by 95%. So you don't have to have very much CoQ10 to have your results raise up substantially. Now, this is what you may not know, and I have seen this in health food stores, CoQ10 in a tablet, CoQ10 in a capsule. CoQ10 has to be liquid in order to work. Don't ask me why, I'm not a scientist, I just know that that's true. We have CoQ10 in a liquid. It is gold. I think they make it gold because it's very, very expensive. 1 dropper full of this is like 600 milligrams. So, and the dosage is 1 full dropper per day. There are 74 doses in here. Now, CoQ10 is really, really good if you've got gum disease, if you've got gingivitis, if you've got receding gums. We have seen people put this in their water pick, put this in their rinse, do it at night, don't drink anything, eat anything after that, and we've seen the gingivitis and the receding gums just kind of go back to their normal status. And so this is something that's really, really good. CoQ10 has to be in a liquid form to be bioavailable. So just going to throw that out there. When serum levels of CoQ10 were increased, the inflammatory markers were significantly improved. So this is one thing, if you've got a sickness, if you've got a disease, then we want to make sure that we help you with this. Now, I'm looking at a manual. This is from Dr. Darren Willoughby. He is a professor at the Baylor College of Medicine. So he's at the Biomedical Science Institute. So all of this is really, really good information, and this is about minerals. Now, I know a lot of people think that if you eat a good diet, you're going to get all of your vitamins and minerals, and that's just not so. The food choices that we have today are not nutrient dense. So that is because we do not do, as we learned in 4th grade, we do not do terraced farming, we do not do strip farming, we do not do crop rotations. So big agricultural industry has really robbed the soil of most of the minerals that are in there. Now, if you have a good diet, your liver can make your vitamins, but your liver cannot make your minerals. You must have minerals from the ground in order for you to be able to get the nutrients that you need. So I just tell you a little story. This is me. I have chronic back pain, muscle pain, right in the small of the back. And those of you that know me know that I had scoliosis when I was young. I have a spinal fusion. The chiropractor tells me that because I am advancing in age and I have had wear and tear and no mobility, that I'm going to chronically have this pain. Well, I don't like pain. I don't think you have to have pain. And so one of the things that I did a few months ago now, is I was standing in the clinic and I was thinking, you know, this really hurts. I must be deficient in something. Now, I have a good diet. I eat really, really well, and I take a lot of supplements because I want to stay healthy. But one thing I don't always do on a daily basis is to take a multi-mineral multivitamin. So I'm standing in the clinic and this little bottle just jumped right out at me, and it is called Daily Build. It is a multi-mineral, multivitamin, and herbal supplement. Now, I love this. This comes in a capsule, which I'm holding in my hand. It also comes in liquid, so if you have trouble swallowing capsules, then that's something that you could look at. But this particular vitamin is just the one that just kind of leaped out at me as I'm looking at the shelf. So I took 2. I bought it. I took 2. And within 20 minutes, I would say that the back pain was probably 90% less in 20 minutes. And so I thought, this just can't be true. This is just some kind of mind over matter thing. But I noticed when I did not take the minerals, the pain was quite severe. But when I take the minerals, then the pain is much less severe. So this is kind of a cool thing. So if you are like I am, advancing in years, and you've got some aches and pains and that kind of thing, then you might see that if you up your minerals, that you're going to see some good improvement. So one of the minerals that everybody talks about is calcium and magnesium. Now, these are not necessarily micronutrients. These are more of your macronutrients, but almost the whole population, according to Dr. Willoughby, is deficient in these minerals. So let's just see what he says. And one thing he does say is you don't want to do minerals in a single tablet. Like, you don't want to do calcium by itself and magnesium by itself and the other things by themselves, because you're not going to get the right ratio so that your body knows what to do with it. And so we want to help you understand that we have really good blends. And we do have some things, and I'll talk to you about that. But most of the time we want to take a multi-mineral, multivitamin in a composite form so that the body can do with it what it needs to. Now, if you don't like pills, if you don't like the idea of swallowing pills, we've got this great formula, and it has all of your macronutrients and all of your micronutrients. Now, you only have to do 15 drops twice a day. It's brilliant. There are, let's see how, well, this bottle will last you probably 2 or 3 months. So if you don't like taking vitamins, then this is something that the right ratio. They are pH balanced, they're ionic. That means you take them in, they go right up into the system, and they're really good. I take those every day, but I was not getting enough at the recommended dosage. I just wasn't getting enough to help with that chronic muscle pain. So just going to tell you that. Okay, calcium. Calcium, they did a study. The California School of Medicine analyzed the diets of 6,600 men and women and found that the risk of developing high blood pressure was lowered by 12% for each 1,000 milligram of calcium that they took daily. So if you are suffering from high blood pressure, you might want to think about upping your calcium. Now, for calcium to be absorbed, we have to have the cofactors. We've talked about that before, but we'll get into that in just a few minutes. So the benefit of calcium is its role in brain function as well. It helps you to transmit your nerve impulses. So if you have neuropathy, if you have funny thinking, if you have brain fog, you might be having that because you are not taking enough calcium. Now, a lot of calcium that you get in the big box store is calcium that is made out of chalk or talc. Those are not bioavailable, and you're not going to get any benefit from that. So you don't want to buy calcium from a big box store because, as we've talked about before, the big box stores use the absolute cheapest form of the mineral, and it may not be bioavailable. So we want to make sure that you get the right kind of calcium, because the right kind of calcium helps you build neurotransmitters. Now, if your neurotransmitters are out of balance, what's going to happen? You're going to have insomnia, you're going to have anxiety, you're going to have panic attacks possibly. You may even have bipolar. So this is a nutrient that rebuilds your neurotransmitter. So these are some things that you want to look at. The calcium needs vitamin D, magnesium, phosphorus, zinc, vitamins A, and vitamin C. So you don't want to just get calcium by itself. You want to make sure that it has all of these cofactors. In this study, 1,200 milligrams of supplementary calcium was taken, and it reduced by nearly 50% PMS symptoms. So if you are a lady and you are having PMSing once a month, you might find that your calcium intake would be better for that. So we might want to think about that. Teenagers, okay, teenagers need, let's see, they need at least 1,300 milligrams. Women over 50 need 1,200 milligrams, okay? So we need to make sure that we're getting enough calcium. I mean, you're not going to get the calcium in your milk, even though milk is fortified, and a lot of people think that milk is full of calcium. It may be, but milk is almost non-digestible by most people. So I'm just going to throw that out there, okay? Magnesium. Now, magnesium is something that almost always goes hand in hand with calcium. Magnesium helps the body utilize the calcium, or helps that calcium uptake into the body the way it needs to. So PMS as well. Okay, you need to have the magnesium will help with that. Magnesium helps if you have foot cramps, right? So a lot of times people think that if you're cramping, you need potassium, and yes, you do. But if you have foot cramps specifically, then that means that your magnesium is out of balance. So you want to make sure that you do that. So there's some food sources that you can get your magnesium: sunflower seeds, blackstrap molasses, pistachio, wheat germ, almonds, and soy lecithin. Now, I'm a little reluctant to recommend soy products because almost 95% of the soy here in the United States is genetically processed. I don't think that soy is good for women because soy is a phytoestrogen, and that means it wreaks havoc with your estrogen levels and your thyroid levels. So I don't really recommend soy for women, but if you must do it, then I want you to do a non-GMO variety, okay? So the recommended intake of magnesium is 400 to 600 milligrams daily. And you do want to have a ratio of 2 calcium to 1 magnesium. So double the milligrams of calcium that you are taking with your magnesium, okay? Does that make sense to everybody? Okay, one of the micronutrients that we might be missing is manganese. Now, manganese is really, really small. You take, let's see, only 5 to 10 milligrams a day. But if you do not have manganese, then you're not going to be able to absorb your calcium and your magnesium. And your body won't heal, your bones won't heal. So us ladies of a certain age that are prone to osteoporosis, then we always need to make sure that we've got manganese in the supplement so that we're able to get those bones repaired. So this also works for sore muscles or tight muscles. So when I was looking at this component here, and I was telling you about how it just helped, it's got all of these tiny little micronutrients in there. It's got the manganese, it's got the zinc, it's got the copper, it's got the iodine, it's got the chromium, it's got all of the micronutrients that we're talking about here. So maybe that's why it just worked so well. Chromium. Now chromium, we use this in our weight loss clinic. Why? Because chromium helps you with carbs. If you crave carbs, if you crave sugar, then chromium's going to really help you with that. Now, chromium is a micronutrient. It's called a trace mineral. You only need 100 to 200 micrograms a day. Now, we've got really supercharged, so I think if you get ours, you're going to get 500 micrograms a day. But we find with Weight Loss Clinic that it really helps people with their carb craving. So if you're always craving that pasta, if you're always craving that yeast bread, you probably have a candida issue, but this chromium's really going to help you with that. Now, their study shows that if you are an insulin-dependent diabetic, that if you take chromium, the chromium will help you and it will cause your blood sugar to stabilize so that you may be able to come off of that insulin. So that is something that is just great. It's a great protective nutrient. So you can get chromium in mushrooms, eggs, chicken, honey, whole wheat, and brewer's yeast. Well, I don't know if you've ever taken brewer's yeast before, but it's just not great. I'm not talking about doing it in the liquid form. I'm talking about doing it in the powdered form. And they do sell a supplement of brewer's yeast in a powdered form. You reconstitute it with water, and it just doesn't taste all that nice. Copper. Copper is good. It's a good nutrient, and you've seen all these things on the TV about how copper helps with muscle pain, and they've got these new clothes and it has copper threads and all that kind of thing. For years, people have been wearing copper bracelets for arthritis and that kind of thing. So a lot of people are nutrient deficient in copper. Well, copper, you don't need very much of it. The bottle I showed you a while ago does have copper in it, but you can get copper from your food as well. Flaxseed, peanuts, pecans, walnut, liver. I'm not a fan of liver. Oysters, prunes, and raisins, and believe it or not, chocolate, all have copper in it. Red wine also is a good source of copper. So I don't know kind of how you feel about that. You don't need much. You only need 1/2 to 3 milligrams a day in order for you to get what you need. Now, one nutrient I do want to talk about is iodine, and there's a lot of misinformation out there on iodine. So 80% of women have thyroid issues, right? Most of it is hypothyroidism, which is a thyroid that burns too slowly. The way that you find out about this is you take a blood test, and the blood test will chart your TSH, thyroid stimulating hormone. Now, your thyroid is right here at the base of your neck. But your hypothalamus in your brain, your pituitary in your brain, and your adrenals, which sit right on top of your kidneys, they all have a feedback loop that tells the brain what to do about the thyroid releasing hormone to tell the thyroid to do what it needs to do. So if your thyroid's not working correctly and your doctor has you on levothyroxine or Synthroid or Natrethroid or something like that, and you're not addressing the hypothalamus, the pituitary, and the adrenal glands, and you're never ever going to get ascendancy on your thyroid issue. Okay, so I hope that makes sense. Now, part of the problem is with this is that your TSH within normal range on your blood work is on a bell curve. It says that for most people, if they're within this range, their thyroid is working correctly. Well, the last time I looked, I was not a bell curve. I am a unique individual, and my body is set that this particular point in that bell curve is what is normal for me and what my body needs. And so there are some certain symptoms that you can look for. If your eyebrows are thinning at the outer third, your thyroid's out of whack. If your nails, I know a lot of us women, you can't tell because we go and get prettied up, but if your nails have ridges, look at your toenails. If your toenails have ridges, then that's another sign of thyroid insufficiency. If your tongue has ruffles, when you stick out your tongue, if it has ruffles around the edge, what that means is your tongue is too big for your mouth and the teeth are making imprints on the tongue, and that means that you don't have enough thyroid stimulating hormone going around so your thyroid's working properly. So I know everybody's sticking out their tongue and trying to see what it looks like. So this is a great resource. I would really recommend you getting this book, and I know it's backwards. It is called Iodine, Why You Need It, Why You Cannot Live Without It. It's an easy read. It is written by Dr. David Brownstein. He's an MD. He's a board certified family practitioner, and he is a holistic doctor. Now, I had been reading a lot about hypothyroidism, Hashimoto's disease, because we have a lot of people that come in here with that. And so the product that we have here, and this is actually the product recommended in this book, so I was already doing the right thing. But this product says only do half a tablet per day. So a half a tablet per day is, let's see, how much is it? Oh, it's like 3 milligrams. 3, okay? What Dr. Brownstein says in his book is that most people need 150, maybe to 500 milligrams per day. Now, I know if you do the Google search and all that kind of stuff, you're going to find that iodine is toxic. And if you'll read this book, Dr. Brownstein explains how that study that was done was a flawed study. It's never been repeated. However, it's out there, and you know how things are when they get out there, that they have a lot of problems. So I will tell you, cold hands, cold feet, thinning hair, all of those are other symptoms of hypothyroidism, when your thyroid is not working the way it needs to. So this is something, like I said, that 85% of the women have. Mostly it is undiagnosed. So what we found, oh, also fibroids. If you have breast fibroids, if you have uterine fibroids, it's because your thyroid's not working right. So in the book, Dr. Brownstein says that if you supplement with iodine, that the fibroids will go away and that the thyroid issues will be reversed. And so we started doing this in the clinic. We started doing mega doses of this, and I was very, very pleased with what happened with our people. Now, one of the things that you need to understand is your iodine receptor sites are also receptive to bromine and also chlorine. So where do we get chlorine? From our water. Where do we get bromine? From our bread. And so if we have, if we eat a lot of bread, or we've eaten a lot of bread in our past, and we drink chlorinated water, those iodine receptors in the thyroid could be plugged up with those other chemicals. And so what's going to happen when you take high doses of iodine is it's going to push out the bromine, push out the chlorine so that the iodine can go in and sit in those receptors. Now, what you might find is that you have a heavy metal taste in your mouth, and you might find that you have a lot of headaches. So what we have seen and what Dr. Brownstein saw is that people began to take a lot of iodine on their blood work. Their iodine was like out the roof because they weren't metabolizing it. So they had this, this is called ATP cofactors, and it is really just mega doses of vitamin B2 and vitamin B3. What that does is help the body utilize the iodine that you're taking. So if you want more information on that, you can download this book at Amazon. You can buy it at Amazon. That's what I did. Speaking of Amazon, I do books from Amazon. I do not do supplements from Amazon, okay? You're great practitioners, your great vendors do not sell on Amazon. And I am running out of time, so I apologize. Selenium. So if you have a thyroid issue and your thyroid is not working properly, then we have selenium by itself. This is 200 micrograms that you can add to your Synthroid, levothyroxine, whatever. This one has selenium in it. So you take 2 of these versus one of these, one of these, one of these, one of these. So you're gonna really do better if you have something that is a multi-mineral, multi-vitamin. Now, selenium helps the thyroid work, but guess what? It also protects you from cancer. Breast cancer, colon cancer, ovarian cancer, pancreas cancer, and prostate cancer. So I know this is October and everybody's all aware of breast cancer and that kind of thing, but selenium will reduce your onset or your susceptibility for breast cancer and all these cancers by 60%. That's a lot. So if you have breast cancer in your family, if you have prostate cancer in your family, colon cancer in your family, if you take 200 micrograms of selenium every day, you reduce by 60-something%, right, the possibility of getting that cancer. So I think that is a great thing. It also reduces lung cancer by 50%. That's huge. That's really, really huge, okay? So 100 to 200 micrograms a day. The one that we have that's all by itself is 200 micrograms, so that's that. So I want to talk to you about zinc. Zinc is amazing. Zinc is in this one. Zinc is in this one, okay? But we have here at the clinic zinc. This is a liquid zinc. And we can do a zinc tally test. Now, I don't know if any of you have done zinc lozenges when you've had a sore throat, when you've had a cold, that kind of thing, that you can buy them over the counter at the drugstore, and you take them, you suck on them, let them dissolve on your tongue. When I do 2 or 3 of those, I have a very bitter taste in my mouth, right? That means that I'm not zinc deficient. If you take zinc, and this is the liquid zinc, right? You take a tablespoon, you put it in your mouth, you swish it around. If it tastes like water, you are severely zinc deficient. If it tastes kind of sweet and then goes to bitter, you're moderately zinc deficient. But if you take it and it tastes really like a metal, then your zinc is really up there, and so that's a good thing. So you can take zinc by itself if you want to, but I would rather you get it in a multi-mineral, multivitamin so that you can get all of the good things. So zinc is called the sexy mineral. Why? Because it contributes to the development and function of the male sex organs. So a lot of you guys out there who are having erectile dysfunction issues, it may be just because you don't have enough zinc. So if you get that zinc in there, you're gonna have more power and you're not gonna have that issue. Now we do have zinc by itself. This is only a 25 milligrams, so I would recommend that you would do 3 of these and see what happens, okay? So also zinc is for people with insulin-dependent diabetes. They tend to be zinc deficient. So if you improve their zinc, they're able to take less insulin and then maybe even come off of the insulin. So I hope this has been very helpful to you. We don't really think about these minerals very much. We think about maybe the big ones that everybody talks about, the calcium, the magnesium, the potassium, and all that kind of thing. Oh, one thing I learned when I was reading this book about potassium, potassium is one of the minerals that actually is regulated by the FDA. Most of your potassium you're going to get is in 99 milligrams, okay? So I thought 99 milligram was the official dosage, but no, this doctor says that you might need 1,800 to 4,000 milligrams a day. So I'm not taking near that much. Okay, you need to be careful with potassium. Too much potassium is dangerous, too little potassium is dangerous. So I'm not asking you or advocating for you to take more than the 99 milligrams unless your doctor requires you to do that. So that was just something that I learned, and that was really surprising to me because, like I said, I thought 99 milligrams was the official dosage because that's what the FDA says. So again, I hope that you've learned something today. And if you have any questions, please ask me and I will respond. I know people have checked in. We've had multiple people watching, but the names don't come up on the phone and the questions don't come up. So we'll get back to those. If you have any specific questions, let me know. If you have any topics you'd like me to talk about, then let me know. Just as a PSA from me, I was invited to do a national webinar for Transformations Enzyme Corporation last week. And so I did. I posted the link on our Facebook page, on the Abundant Health and Wellness, and the Abundant Health and Wellness Moms page. I also posted it to my personal page. It's a free webinar, and it's all about aging and breast health. So if you're interested in that subject, click on that link. You do have to register, but it is a free webinar, and let me know how you think I did. For some reason, the video came out purple. Go figure. I don't know why it was like that, so just excuse that, but I hope you enjoyed that video. I will be at the Kingwood Library on Tuesday at 10 o'clock with some more information on breast cancer. So if you're interested in that, then you can meet me at the library in Kingwood on Tuesday. So take care. That will be Tuesday, October the 23rd, I think is the date. So thank you so much for joining me. I appreciate you. It's not the 23rd. Whatever it is, it's in October, okay? Take care. Love you so much. And thanks for sharing your lunch break with me. Bye.